Next, we'll cover how to measure assets, which are basically everything a person or household owns, including belongings used for income-generating activities, as well as personal belongings. In general, assets are more stable measures of wealth when compared with income and consumption. Another advantage to measuring wealth through assets is that there is typically less error in reporting which assets are owned. For example, asking someone if they own a working television or not is likely much more straightforward than asking how many servings of meat a person has eaten in the past week. However, the stability of assets can also be a downside. If it's change that you're actually trying to measure, so for example, looking at the effect of an intervention, then changes in assets might take longer to show up and they might be harder to detect. In that case, you would want to use possibly income or consumption because these will respond more quickly to the intervention. Also remember that assets are usually owned collectively by households. This means that it's very important to measure the size of households and to take this into account if you want to get a good idea of how assets relate to the well-being of individuals. Measuring health. Health is actually a very subjective and difficult to quantify concept. It's possible to directly measure health-related outcomes like weight, height, iron count, and blood, and these can help you to detect malnutrition, test for diseases and parasites. But this is a very labor-intensive process, and it's not normally something that you'll have the budget to do. Short of this, health outcomes can be measured through surveys. However, be cautious with this, as there is often selection bias in measures of illness and health. For example, let's say that you observe that more educated individuals report visiting the doctor more often. So what does this tell us? Well, it could mean that more educated people are actually more likely to get sick for some reason. However, the much more likely explanation is that more educated people are more aware of health issues and they're more likely to visit clinics when they do get sick. In other words, they may be sick less often, but nonetheless report more doctor's visits because they have better access to healthcare. So, the solution to this problem, if you're only using surveys to collect data, is to ask about specific health-related outcomes or behaviors rather than asking about treatment or diagnosis of diseases. Doing this avoids the bias that can occur when diseases are more commonly diagnosed among one population, like urban educated people, for example, who have better access to medical care compared to the rural poor who have poor access to medical care. And in this case, the urban population will appear to be less healthy simply because their ailments are more frequently treated by doctors. So this means that it's better to ask about specific symptoms rather than general diagnoses. So you should ask about incidences of fevers, diarrhea, etc. specifically rather than incidences of particular diseases which might cause these symptoms and would require a diagnosis from a healthcare professional. You can also ask about days missed from work due to health-related problems. Another possibility is to ask about specific behaviors, which typically lead to better or worse health outcomes. So examples of these behaviors include use of bed nets, nutrition, so asking people how often they consume meat, for example, condom use, sanitation infrastructure, so whether they drink water from covered wells and use improved sanitation facilities, and personal hygiene, like the use of soap. While this won't give you an exact measure of an individual's health, it can help you to understand the health status of a population on average. Asking about certain health-related behaviors and outcomes can be tricky, however, since many behaviors are sensitive and people typically don't like to talk about these behaviors to strangers. This is especially true in more conservative societies. The best way to ask about this information is to put time into developing questionnaires and to ask about the information in the most culturally acceptable way. Consulting with local staff and piloting questionnaires helps a lot in this regard. Special training for enumerators asking about sensitive information might also be advisable in some circumstances. Lastly, this information should obviously be kept confidential, so make sure that the questionnaire can be administered in a private area where others cannot overhear answers. Otherwise, the data you collect is much more likely to be inaccurate.